Insight. I am your host, Reverend Dr. Coles. This broadcast is about sharing information with the community, bringing those resources to you. So I'm hoping that you have your pen and paper today. And today we don't have one, but we have two guests that's here with me today. To God be the glory. Travel down here to be with us, to share some information with you. So please be ready to listen to this information coming to you today. Today we have Miss Betty. Miss Betty, welcome to Community Insight.
Thank you. Thank you. It's an honor to be here. I thank you for the invitation.
Amen. And then we have Miss Angela. Please, I will be calling by Mrs. My mama will spike me. I don't want no whoopings.
Not a problem, Dr. Cole, but it is such a pleasure to be back in Greenville again and to have an opportunity to provide information and engage with the citizens of Greenville. So thank you.
Well, we definitely welcome y'all to be here. But folks don't know the things you do. And I tell you, it's like I know Miss Betty for 20 years. Been working with her for a few months.
Gotcha.
And it's the things that you guys do. And but before we get into the meat of everything, we all know who we are. We all children of God. But what we're going to talk about a little bit of things you do. Miss Betty does a lot. You do a lot. We're going to bring that out as well before we get to this main dish. To give you a little advertisement when you get to the food. So Miss Betty, could you please tell us some of the things you do? Because you are a mover. You are a shaker. I mean, these millennium kids, they better listen to this and catch on to this here.
I have to come to Greenville more often. Exactly. Compliment. Thank you, Dr. Coles. Yes, I am Betty Murchison. I'm a business consultant. I have OASIS training and consulting. I work with nonprofits and for-profits across the state and a few that are outside of North Carolina. The sweet spot, the thing I think I'm best at, is making collaborative partnerships between nonprofits and for-profits so that everybody benefits from it. But I have over 20 years of experience working with nonprofits. I help people from the point of, from their idea to ribbon cutting, I like to say. From the concept, helping refine the concept, helping them to apply for their 501c3 designation, and establishing a board of directors, doing strategic planning, grant writing, the whole aspect of nonprofit management. And I also do consulting work with organizations such as Community Campus Partnerships for Health, which is how I came to be involved with this project.
Okay. And Miss Angela, what are you involved with? You got a list there too now.
Listen, I can't top Betty.
Yes.
She is the ultimate connector. But again, I am Angela Dunstan. I'm with Dunstan Consulting. And I always consider myself a servant leader. I've always said I'm an advocate and I'm an activist for the people. So if there's an issue that can help the people, that's where I am. But like Betty, right now we're both working with Community Campus Partnership for Health on this amazing opportunity to hopefully save lives, but also decrease the spread of COVID. And so thank you again for allowing us to be here.
And it's been a pleasure getting to meet you because you be on those Zoom meetings. It's like things like you can see somebody face to face. You know what I'm saying? Like and the things you bring out. And thank you for the service that you do because I truly believe that, see, when God brings us all together, He brings us together to serve, not to be served.
Right.
And people don't understand service is the rent you pay for the space you take up on earth. We're here to serve. And just to hear what you're doing, to hear about Miss Betty, even with those business and nonprofit, because there's a lot of nonprofits. They think they know what they're doing, but they don't know what they're doing, especially when the IRS come after them.
Okay.
You know what I'm saying? So, and I was saying, if you're going to have a business or working with a business or a nonprofit, get somebody that knows what they're doing. Being cheap is expensive. I'm telling you. You know what I'm saying?
It can be.
Trying to cut back. You know, and that's a good thing. You know.
Yes, we believe in healthy nonprofits because people generally start nonprofits with the idea of helping the community. There's a need, there's a gap that they want to fill, and they really come in innocently. And I have to help them understand this is a business. A nonprofit does not mean you don't make a profit. It doesn't mean you don't run it like a business. And so we spend a lot of time training. I do workshops and trainings to help people understand the process.
Well, there's some people who listen to this broadcast. I hope they take your number because it's key of helping your nonprofit. I see a lot of churches and they building ministries and they think they have all the formulas and they really don't.
They really don't.
And that's been some of the things I've been doing, helping you with. This is what you need to do. And I tell you, sometimes I'm going to say it all there. Sometimes you try to help people and they could be like a splinter irritating to you, like I don't know what. I said, Lord, give me patience to deal with this person.
We don't run across
So
any of
we
that.
don't. But Dr. Coles, you're exactly right. I worked for state government probably for close to 20 years. And I've been on the other side of trying to help individuals understand what's available to them, whether it's from the federal or the state level or at the local level. And sometimes we do have to help our own people understand what they need. But again, being a servant leader, being an advocate, we're oftentimes called to this work even when we don't want to be called.
You speaking now.
Because God has said there's something in you that I want you to share with others. And so hopefully that's the kind of work that I'm doing. I know Betty is doing it because I've seen her do it for 20 plus years. And it's been a pleasure to watch you work in this community and bring so much to the individuals in this area. And so we're just excited about partnering with you in the work that we're doing.
Well, the partners is all honored with me because the people that could be on time and beat me here. I said, wow. I mean, I'm trying to find where you are. He said, no, we already here.
Don't play with
I mean, that's what I'm talking about.
Yes,
But it's so good to know that folks out here to help because we do need to help the community. We do need to help the people who has a heart. And I'm going to speak as a pastor at this moment. There's sometimes pastors in the church don't allow people to do certain things, and God gave them a gift to do it, and they try to tell them to park it, but they on fire for the Lord. And when they on fire, you better let that fire go and let them do it. But don't tell people just to pray on it and see what God's going to do. If they're telling you they receive it, believe that they receive it and help them through it so they can take it to the next level. We need people like y'all to help us take it to the next level because dealing with ministry, dealing with businesses is not easy. You're going to have the challenge. You're going to have the ups. You're going to have the downs. Some people don't have board insurance. Some people don't have general liability insurance. Some people don't have a good accounting. And then they get into the snag. And some people tell me, you could do this, you could do that. No, if you got a grant, the grants that do A, B, and C. Don't you do D to Z now and think it's all right. But let me pause here because we could be on this here for a long time. Let me stop. I'm going to mess up the whole program this morning. Amen.
We'll be back for that.
That's right, exactly. That's a whole nother program.
Part two, right?
That's a whole nother program.
But we're here today because I will say, working with both of you, and I probably call Miss Betty every morning, 7:30, sometime in the morning. She picks up. I say, amen.
She's an early riser.
And to talk about the corona, to talk about the COVID test, home test, could you explain a little bit about this, Miss Betty? What exactly is this? If for folks may for the first time hearing about this.
Oh, wonderful. Yes, I'd be very delighted to do that. Pitt County, Greenville, Pitt County has the distinction of being chosen as the first community in the United States of America to have the distribution of these COVID-19 home test kits. There are 25 test strips in this kit, and they are being given out by local faith communities, community centers, the health department here in Pitt County. A lot of different organizations are distributing these to the community. They are free. They are free. You can pick them up, take it home, test 2 members of your household 3 times a week until the tests are all gone. And this is a project that is funded by the National Institutes for Health, the Centers for Disease Control, in collaboration with Duke University, UNC Chapel Hill, and NC Central University in Durham. So there's a big team that's involved with this project. We were very, very fortunate that Greenville, North Carolina was chosen, thanks to Ms. Mildred Council, who knows everyone here and everyone knows her. She pulled together the A team. This is a dynamic team. Dr. Cole is one of the leaders in this movement, and they have been able to distribute over 20,000 kits across Greenville, Pitt County through their networks, as well as ordering. People can order the kits online, and they will be delivered to your door, or you can pick it up from a community center, a community agency that you may be familiar with. And Dr. Cole's warehouse is where we're storing the kits, and people are picking them up there for events. The Latino community has had several events, and they have been able to get the kits in the hands of people who are frontline workers, and that's our biggest concern. Many frontline workers have not been able to be as secure as some of us during this pandemic because they have to be out there serving meals, delivering your mail, working at hospitals. And we know for a fact that these kits have worked the way they were intended to. We know of at least 2 cases here in Pitt County where people who took the kits home tested positive. They went to one of the healthcare providers, and they confirmed that they were positive. So instead of going to work, they stayed home and isolated themselves. One of the businesses is a small business with just 20 or so, 26 employees, and had this person come back to work, it might have shut down the whole business, because with a small staff like that, you could have easily infected everyone. And so it's very important that we test ourselves, that we know our status, because we know there are a lot of people in the community who don't want to take the vaccine, and that is certainly your option. But for those of us who have health concerns, it's very important. We don't want you taking anything home to grandmama, who may be more vulnerable than you are as a 20 or 30-year-old person. So Greenville has just been amazing. Greenville, Pitt County has been amazing in this partnership with us in distributing these kits. And we still have more. The project will be winding down, but we do want you to please consider connecting with one of the partners and getting the kits. And I can tell you a few of the folks who are partners with us where you can pick up a kit. Holly Hill Baptist Church, their Life-Changing Center. Sycamore Hills Baptist Church, where the Pitt County Commission Chair Ann Huggins worships at. The Philippi Church of Christ. American Legion Post 160 on Chestnut Street in Greenville. Churches Outreach Network Center, which is Dr. Cole's facility. The Philippi Missionary Baptist Church, which is in Simpson, North Carolina. The Pitt County Health Department. A Mexican, and there are other community members who are not a part of the original list. But please seek out one of these people and get your kit. Take it home. It's about the size of a box of Kleenex. And we would love for you to be a part of the Say Yes to COVID testing.
And let me say a little bit about this test. It's really convenient for the community to take this, because you see, if somebody was positive, no one wants nobody to know your business.
That's right.
You can take this test at home, and if you say, hey, if you know that you positive and you can't go to work, you let your employee go there. Sometimes employee might say, well, I want a real test. Then you go get a real test.
That's
but
right.
you could go to another county where people don't know your business.
That's
you know
true.
what I'm saying?
That's true.
But I think this to be so benefit for our community that you can test yourself, because some people may say, I got the vaccine, and that's all good and well, but who said you still can't get it?
You can still get the virus.
And if it would continue spreading, it's like you put a fire out and there's a little dust there. If you don't get all the fire, it's still going to be a fire.
That's right.
And it comes right back up again. But if you can test yourself at home 3 times, and it's very, very simple. Listen, you don't even need to have a PhD to do this here. Very simple,
Yes,
where you put the solution in, and then it's a Q-tip, long Q-tip, just touch it just a little bit. Don't go all the way up there. But have a video to show you how to do it.
That's right.
Just touch it each side. Put that in for 1 minute.
That's right.
After 1 minute, make sure your hand is clean before you do anything. Then you take the strip and you put the strip in and time it for 10 minutes. And you can find out whether you're positive or negative.
That's right.
And I do the kit all the time, 3 times a week.
Yes.
I know how to do it. I memorize it because I do it every day.
Yes.
3 times a week I do it. But to show you that you can be sure that you're not positive, that I'm not affecting nobody, this is something that we need to continue having. I'm so grateful to God first for allowing your guys to come down. And I'll talk about Miss Mildred Council. Her and her Bishop James Tripp. I know them. I met Bishop Tripp them 16 years ago.
Really?
That's how long I've been here.
Wow.
And he always been a person. Bishop Tripp doing something. And Miss Counselor, when they started the Intergeneration Center, her and another councilman, Rose Glover, they was the main Captain Hardy. They made sure we had this center here. You know what I'm talking about, Dr. Leslie Bass. And so Miss Counselor been always helping in this community that need to be done. And also Miss Ann Huggin, our commissioner.
Yes.
So the team of people you have here is a team of people.
Yes.
To make it happen.
Yes.
So this kit is so easy. And they can get this kit from us.
Yes.
They can go online.
Yes.
And you're also doing this in another area.
Yes. I'm leading the Greenville effort, and Angela Dunstan is leading Chattanooga, and they just launched last week.
I am, and again, we're gonna have a competition to see how many kits we can distribute. Who's in the lead, whether it's Pitt County or Hamilton County. So we'll let you know the results afterwards. But yes, I am working in Hamilton County, Tennessee. Pitt County and Hamilton County were the 2 counties out of the entire nation that were chosen to pilot this program. And so we're so thankful again for Pitt having the lead, setting the framework and the model for how this work is done. And so again, so thankful to all of you for all of the hard work you put in. So you've drawn the line for us to now have to chase behind you. You raised the bar. So we got to chase behind you in Hamilton County. But we're up for the challenge, so I'll let you know how it works out. But yeah, we just started in Hamilton County. And hopefully it will be just as effective and successful as you all have made it in Pitt County. Again, this is all about saving lives and slowing the spread of COVID. As you said, Dr. Coles, even if you have taken the vaccine, you still need to test to make sure that if you contracted the virus, that you don't spread it, whether it's in your household, in your work environment, in your faith community. We still are in the midst of a pandemic, and we've got to follow safety procedures to ensure that we continue to take care of ourselves and others. And so, we're excited to, again, look at all of you as the model for what we're going to do in Hamilton County. Just started, as I said, I think we've distributed maybe 5,000 kits so far, but that's a good start for a first week. And just looking forward to the success of this program, how we continue to save lives, and then what else is that we can do as a community in Greenville to continue to have success and to keep citizens and residents here safe.
And you
I just wanted to talk about the safety of this product. This is the same company, Quidel, who invented the home pregnancy test kit and the flu kit. So this is not, it's new in the sense that it is testing for a new disease. But the company is a trusted company, and they had to get special approval from the federal government for them to be able to put this out. But I was in Walgreens the other day, and I know CVS too. They have another company who's making these test kits, and it was $23 for 2 tests in the kit. $23 and change in Walgreens for a home kit that had 2 in there, and we have 25.
That's right, 25.
25 in this one. So it's like this is an opportunity. If you have children in college that are coming home soon, you want to have this on hand because people can have COVID and not have symptoms. That's asymptomatic, and they may not know what they're bringing home to grandmama. So there's nothing wrong with requiring it. We told our family when we have cookouts or picnics in the backyard this summer, your ticket to enter will be your vaccination card or a negative test. I'm not taking any chances, and so it's a great opportunity for Pitt counting.
And just picking back on what you just said, Betty, we did the exact same thing. We recently celebrated Mother's Day. And so we decided to have an outdoor, socially distanced, safe COVID Mother's Day celebration. But everyone had to do a swab test. So it's an opportunity for you to do this with your family, with your friends. Again, as you said, Dr. Cole's a quick swab.
That's it.
10, 15 minutes, you know your results,
That's
and
right.
you can move on about your day.
That's right.
So, again, just want to continue to encourage everyone, especially our millennials.
Yeah.
Because,
Come on. Yes. Oh,
we
Lord.
love our millennials.
Yeah.
They know so much. They help us with our phones and technology.
Yes, they did
But
show us that.
But there's some things that we have to help them understand the importance of. And
Yes.
so, again, encouraging everyone, but especially our millennials, to take the COVID test, to
Yes.
participate, and there's a survey that goes along with that.
That's right.
There's an opportunity for you to get up to $100 in gift cards if you participate in the survey.
Wow.
And so, again, a way to save lives, but also make a difference. And so
Yes.
we're encouraging people to do that.
Yes.
And it is such a great product the way it was made. Like you took the words out of my mouth. It's like a pregnancy test. I didn't know it was the same,
Yeah.
the same
Same
company.
company.
And we have to stay safe. It's
Yes.
funny. Same thing. Like in my home, we don't allow shoes in. Take your
Gotcha.
shoes off by
Okay.
the door. And there was one time I had a alcohol bottle. I was spraying people
Yes.
because they had make sure they had no bed
That's
bugs.
right,
You know what I'm saying?
yeah.
So
No.
we get
Yeah.
and so my thing is the same. Take the test.
Right.
If you don't have that card, take the test. And if you find, then you proceed in because I have my children, my wife, and other people in my
That's right.
surroundings.
Yeah.
And like you just said, they have it for $23 in the store. And you're getting this free. I am praying to God that Congress and everybody out here that know about this kid to keep it free.
That's right.
We need to keep this free so we can stop this disease of spreading. People can't afford $23. Whatever we can do. Because it's amazing how we can help everybody else all around the world, but we can't even help our own country in some areas. And I'm thankful for the leadership now. I'm not knocking anybody down, but the leadership now that helping them. And I do believe it's good to get the people the stimulus money, but you should have had a budget class where they use that money because a lot of them use the money wrong.
Yeah.
But besides that, it's good for that to take place. But also, we need to look at how we keep this going, how we hit these areas that's so raw areas. Because in this ministry that I do, there's a lot of people I deal with. They don't even have lights on their house. I had to make food boxes that is non-perishable that you can eat, snap cans. I said, you want to donate? You got to donate this to me where they can eat right immediately and they, without worrying about a stove, things like that. And if we want to stop that, this is where it's gonna be. And I do believe that if people take the test and they find out that they are positive, eventually they will say, "Hey, I need to do something about this."
That's right. And you're right. I heard stories. Bishop Tripp told us about a lady who lived way out in the woods with her elderly mother. He took a kit to her, and she said they had not left the house since March 2020.
Woo.
They had not left their rural home. And so I know she is not an isolated case. There are other people who are so afraid that they are not leaving their home. There's a box out front where people would leave things, food or whatever they would bring into them, and they would sterilize it before bringing it in the house. So how do we reach those rural communities? And maybe the audience can help us with that. If you know you have neighbors, you have relatives, you have friends, and you haven't checked on them for a while, please check in on them. Please come by, pick up a kit for them, and take it by and drop it off for them, and not just for you and your family. Think about your community and the community at large, and do what we can to help others.
And that is so true. This is the opportunity for businesses and also nonprofits
Yes.
and churches to say, "Hey, we're here and we can pick up a box of kits and help distribute it to the community
Sure.
where people don't have to go too far trying to
Yes.
spend money for gas, because in our area, in a lot of areas, they don't have mass transportation. So we want to make it
And right
easy.
now we don't have any
Gas.
gas. I was so glad to find some this morning in Raleigh before we came here. So
Wow.
it's a real issue.
Yeah.
That's an
it
issue there,
is.
you know.
It's an issue.
I told my wife today, and listen, we don't have much gas. You had a half a tank. I got a half a tank. I said, listen, pack your lunch today. Don't go out for lunch. because we need to save
That
every
is
gas
true. No,
till we
that
get
is
there.
true.
Because hey,
Right.
when you get to that red light, I gotta drive your car a little
Right.
bit, you know. Mine get there, but we just pray that this is overseas because sometimes we go to these trials and
That's true.
and
That is
you know
very
sometimes
true.
you can see where people who understand God and hit their faith and where God just opened the door for you. He opened the door for you. And I said I was just on the line with a person and I said you know I got my 11:30. So I'm in the parking lot. I was finished the conversation. I said wait for my 11:30. I pray that they be here and once I got off the line with her. I called her just to make
Gotcha.
sure how things. I mean, Betty said, "We
Gotcha.
here already." I said, "What?" I couldn't get
We
out my
had
car.
already called you.
I couldn't get out my car fast enough. So I know that, and God opened the door for
He
that.
did.
Yes,
He
he
did.
did. He did.
He
And I
did.
think he's opening the door for even greater things for Greenville, Pitt County. We are so pleased again to be a part of this. Alan Richmond is the executive director of Community Campus Partnerships for Health, and we're thankful he involved us in this.
Okay, but at this time here, we just want to thank you for being on the broadcast. To God be the glory. Understand these kits are here for you for free. Please go onto the website. It says sayyescovidtest.org. God bless. We'll see you in the next broadcast.